Good afternoon. I'm Dianne Vass, Executive Director and co-founder of the Emergency Medicine Patient Safety Foundation. EMPSF, formed in 2003, is a national 501c3 nonprofit organization dedicated to advancing patient safety in emergency care. I am truly honored to be here today and would like to express my gratitude and acknowledgement to Joe Chiani for your passion, vision, and leadership in launching the Patient Safety Movement Foundation. And to Jim Bialik and all of his team and all of you for being here today and taking a bold stand to aggressively move towards eliminating preventable deaths from preventable harm by 2020. With 130 million visits to our emergency departments every year, emergency departments serve as the front door to the hospital and as the safety net for much of our population. EDs are very high complex environments, often very chaotic, and are one of the most high-risk areas in the hospital for potential harm. The reality is, in order to address these problems, with all of the competing demands to be able to focus on the resources that are needed to deliver the impactful solutions to solve these problems in emergency medicine, hospitals and emergency departments don't have the ability to do that. So in order to get to our goal of eliminating preventable deaths, we have to address the conversation of what's happening with risks in our emergency departments. EMPSF is very pleased to make our commitment and pledge to the Patient Safety Movement Foundation to develop actionable patient safety solutions to reduce risks in emergency departments. It's my great pleasure to introduce today my colleagues, Dr. Drew Fuller. He is the Director of Safety Innovation for Emergency Medicine Associates in Maryland and is a longstanding board member of EMPSF, and Dr. Martin Brown, President of Alexandria Springfield Emergency Physicians. Dr. Fuller and Dr. Brown have served as champions in the development and implementation of EMPSF's Safer Sign Out initiative. Safer Sign Out is a high reliability tool designed to reduce risks of handoffs at shift change in the emergency department. With that, I'd like to bring up my colleagues, Dr. Fuller and Dr. Brown. Thank you so much.
Thank you, Dianne. I'm going to hand this over to Drew in just a moment, but I just wanted to say that from what Dianne said, with all these visits, over 130 million visits, and the high-risk environment that we operate in, our organization felt it was essential that we focus on safety if we're going to be a quality organization. Physicians are critical to achieving the 0 preventable deaths by 2020 goal, and physicians must be engaged and to develop improved systems of care within emergency departments to do that. Dr. Fuller was instrumental in developing one of those systems, and I will give it over to him. Drew?
Thank you, Marty. Thank you. The clock just said 59 minutes. Do I have that much time? Is that right? Don't know. I'm Drew Fuller, and I love my job. I'm an emergency physician, and I've been doing it for roughly 15 years now. And I love the fact that I can be there for you and your family and your loved ones and your colleagues 24/7, 365 days a year. And I love the fact that no matter what you bring to us, we will provide service for it. And I'll give you an example of 2 cases from this week. 20-day infant male was brought in with difficulty breathing, fever, and turned out to have RSV. And we were able to provide service for that patient, get them admitted, and get them taken care of. But it's not just about infants, it's about anybody who comes in. There was an 85-year-old with chest pain that we were able to address and take care of. So not having those barriers is actually a great honor for us to be able to provide that. But more than being an emergency physician, I want to change the world. And I don't want to change the world myself, but I want to help you change your world. And I want to help Joe change the world. I want to help Dianne and Marty change the world. I want to help Dr. Dupree change the world, especially as it relates to emergency care. And not to do it with 30,000-foot solutions that get pushed down to the grassroots, but with actionable safety solutions. And I have to thank Joe for this, because Joe, you're changing the world. because you're changing the way we talk about safety. And you're forcing us to focus on the fact that they have to be actionable and work for the people on the front line. And so that's what we're going to talk about very quickly, because I only have 45 more minutes, I see. I broke it. So this is Calvert Memorial Hospital. It's a very typical county hospital. It's very much like the hospitals in your county. It happens to be 30 miles down the street from Andrews Air Force Base, and it is a wonderful institution, has probably one of the best emergency departments in the state of Maryland. The challenge is this was the status quo for Calvert probably about 2.5 years ago. And what you see there is you see sign out happening. Dr. Barry's sitting at the computer, he's putting orders in CPOE, and we know how safe that is. And then the other doctor comes out and she wants to sign out and leave. And so usually what would happen is there was a very informal discussion, and maybe Dr. Barry would take some notes, and then Dr. Brandy would get in part, and then Dr. Barry would continue on with his work. The challenge was we knew there was a lot of risk with that. There wasn't a lot of high reliability. And so you've heard that the emergency department is a high-risk environment, and we all know that handoffs are high risk. So we knew if we're combining a high-risk environment with a high-risk process, we really have to have high reliability. And this statement right here is not an exaggeration. We would say this a lot during my training, that sign-out was the most dangerous procedure in the emergency department. And due to this, just keep it in mind that it happens about 5 million times a year in our emergency departments. 5 million patients are handed off from one emergency department physician to another. And so these are just some of the lists and factors that lead into why emergency departments are high risk. Not because they're badly run, they're exceptionally well run. I mean, the error rates are relatively low for the level of complexity that's there. But the necessary environment for emergency care makes it a high-risk environment, even our best-run emergency departments. So what do? We said this is no longer acceptable. We can't accept the status quo. We need a high-reliability solution. So as a grassroots movement, we took physicians from Washington, D.C., the state of Maryland, the state of Virginia, and the state of West Virginia, all got together and using best practices and data, came up with a methodology that we eventually called Safer Sign Out, and it was one that was patient-centered, new concept, team-based, and really focused on risk. But it had to work on the front line. And so it wasn't just a checklist, and it wasn't just writing down a patient's name and a list. It was a process that really encouraged good collaboration and communication and a shared mutual understanding of what was happening with the patient, but also seeing the patient, having the patient involved in that process, but also having the nursing team member involved in that process, so they had the ability to provide input. And through this whole process, we realized that there's this critical connection. So sign out or a handoff is not just about the two clinicians providing information from one person to the other. It really does need to involve the patient and the team members. And in doing that, we made a commitment, Joe. We called for a higher standard. And it was a higher standard in communication, but not just communication, but also for teamwork. So these were the hospitals that initially developed it and went forward. They actually none of these hospitals were like each other. There were 11 distinct healthcare institutions brought together, and we were able to show, we like data, that we can make a difference. And so it's a slide that if you, yeah. We believe in transparency. We asked our doctors before we did this, how well are we doing with handoffs? And they told us about 40% of our doctors give us low safety scores when we were doing the status quo, which is practiced probably in 95% of the hospitals around the country. After we did Safer Sign Out, same survey, all anonymous, 1% of our doctors gave us a low safety score. But this is where it's a myth buster, because we're always told that your doctors are going to be the hardest part of getting things moved and getting things changed, because doctors won't standardize. They are too independent, and we like to say that that's not true. Doctors demand solutions that work for them and their patients, and we as an industry need that level of accountability to make sure things work for our doctors and our patients and our teams. And so this slide is the myth buster. We asked our doctors to do a ritualized process for sign out, and they had double the satisfaction with the process than the status quo. So we teamed up with the Emergency Medicine Patient Safety Foundation, and Dianne made it into a national tool and its own website with great resources because we want to get it out there for everyone. But it didn't just stay there. We partnered up with a lot of organizations, and it's now listed from the AMA to the AHRQ to National Patient Safety Foundation is now listing safer sign out as a handoff option. But in addition to that, it's had a lot of national reach. And it's interesting that we just had the media up here because this is the media that's covered it. But it's not just the trade media that's covering it. It's actually the lay media. And we've had 2 articles in the Wall Street Journal. And we want to reach out to people and know that if it's going to be a grassroots movement, it can also come from our patients as well. So adoption has been high. There's been 300 hospitals around the world have downloaded from 10 different countries. And whole healthcare system adoption has happened at MedStar Health, thanks to David Mayer and others, and Chris Beach at Northwestern Medicine, so they've adopted it throughout all their hospitals. So this is just an example of what we can do if we make a commitment at the grassroots level. It's an example of what we can do when we move forward, but this is only the beginning, I assure you. We are absolutely committed to moving forward. We need your help. We need your people. We need your resources. We need your support to move forward and to really make an actionable difference in this world.